Migraines are severe headaches caused by nerve irritation that cause a wide array of symptoms. In this mnemonic video, we'll give you an easy way to remember everything you need to know about migraine headaches for test day. Oops! Watch your head! It's migration season, and one of these birds seems to have gotten away from the flock. This migrating bird hitting this guy's head should help you remember migraine headache. You know, since migration sounds a lot like migraine, doesn't it? Migraine headaches are one of the major types of headaches you need to know. Let's keep exploring to learn more about the pathophysiology of migraine headaches. It seems like this dad wanted his son to come watch the bird migration with him, but like any typical teen, he'd much rather play games on his phone instead. See the Try-Gem game on his screen? You know, the game where you try to match up groups of 3 similarly colored gems? Well, the Try-Gem here reminds me of the trigeminal nerve. The axons of the trigeminal nerve, or the 5th cranial nerve, project from the brain to innervate the meninges, the membranes surrounding the brain. When this nerve is irritated, it can release certain vasoactive chemicals or neuropeptides. Local vasodilation and inflammation around the brain is thought to cause migraine headaches. Next, it looks like a big part of why this kid might be so reluctant is the food. Kids aren't exactly crazy about eating their veggies, and that big thermos of pea soup his dad is holding doesn't look too appetizing. This pea soup happens to also be our symbol for substance P. P's for pea. Easy peasy, right? Substance P is one of the vasoactive chemicals or neuropeptides that gets released when the trigeminal nerve is irritated. Let's keep exploring to find out what the other one is. And just as you might expect from a guy into bird watching, you can tell his dad is a man of finer tastes. See that big calligraphy brush he's bringing with him? Maybe he's planning to paint while he's out and about contemplating the migration of birds. Anyway, this calligraphy brush represents CGRP, since CGRP stands for calligraphy. I'm kidding, of course. CGRP actually stands for calcitonin gene-related peptide, the other neuropeptide that's released by irritation of the trigeminal nerve. So it's substance P and CGRP released from the trigeminal nerve that cause migraine headaches. Got that? Speaking of, that calligraphy set isn't all the dad is bringing with him. He's really got his hands full. Notice how he's pulling open that red drawstring bag to pack a big tripod, since many bird watchers are also photographers to help capture their best moments, right? Well, opening or expanding the ring-shaped opening on this red bag should help you remember vasodilation, since you're widening a red tube, kind of like widening a blood vessel, right? The release of neuropeptides substance P and CGRP causes local vasodilation in the brain. The increase in blood flow and leakage of fluid is thought to cause inflammation, which results in the pain that we know as a migraine headache. Got all of that? Now that we've discussed the pathophysiology of migraines, let's move on to some of the symptoms you can expect. As we move through these symptoms, keep in mind that migraines can affect any gender or age, though it's slightly more common among women. This is helpful to remember because this point contrasts against cluster headaches, which tend to primarily affect males. I bet this dad wasn't expecting to see those migrating birds quite this close. This bird that crashed into one side of his head should help you remember a unilateral or one-sided distribution of pain, since migraine headaches characteristically affect only one side of the head. Migraines usually begin around the forehead or eyes, then gradually move backwards to affect one entire side of the head. This one-sided nature of this headache is a key differentiating factor from other headaches like tension headaches, which tend to affect both sides of the head. Just like any rebellious kid, this guy is blocking out his dad's nagging with loud music. You can tell he's got it turned up super high. The headphones are literally pulsing with the music. This pulsing, throbbing music is also helpful because it reminds me of pulsating, throbbing headaches. The pulsing or throbbing quality of pain is a distinctive feature of migraines not often seen in other types of headaches. It's not a steady pain as you might see in tension or cluster headaches. Say, this kid's looking a little green around the edges. It must be the thought of eating those nasty peas. This kid's nauseous face is here to help you remember the nausea and vomiting associated with migraine headaches. Keep in mind that this nausea has a central origin, meaning it comes from vomiting centers in the brain and not from the peripheral nervous system or problems with the gastrointestinal tract. Nausea caused by migraines may require treatment by antiemetics. Next, notice how this kid has his hands over his ears, is hunched over, and is tightly closing his eyes, probably trying to block out his dad's nagging. Well, you can expect a similar response from those with migraine, because migraine causes photophobia and phonophobia. Get it? Because this basically means an aversion to lights and noise. Patients with migraine headaches will avoid bright and loud places and instead seek out dark and quiet settings to minimize their pain. Related to this fact is the finding that physical activity can worsen migraines, which should be easy to rationalize since this would expose them to more external stimuli. It's a shame this kid doesn't want to tag along, because the aurora is looking beautiful tonight. By the way, don't those shimmery rainbow-colored lights from the aurora remind you of anything else? You guessed it, it resembles the colorful visual disturbances or auras that often accompany migraines. Auroras for visual aura. Makes sense? Migraine auras are sensory disturbances whose exact presentation depends on the part of the brain that's involved. But auras for migraines are usually visual, caused by involvement of the occipital lobe responsible for processing vision. This aura is often described as kaleidoscopic refractions of light. Some compare it to looking through a cracked window. That was a lot of symptoms we just covered, so we'll also throw in another popular mnemonic outside our picture to help nail it down. This is the letters in POUND. P for pulsatile, O for 1 day duration, U for unilateral, N for nausea, and D for disabling. Now we can finally get to talking about treatment. Like I said, this dad is bringing a lot with him on this outing, so it's a good thing he has that sled to get him across the ice. This sled also happens to be our symbol for NSAIDs, because sled sounds like NSAID. NSAIDs, or non-steroidal anti-inflammatory drugs, are commonly prescribed as abortive treatment for migraines, that is, to stop a migraine that has already started. These over-the-counter drugs are the go-to treatment in relieving the pain of mild to moderate migraines. Getting back to the tripod in the dad's red drawstring bag, the tripod can also help us remember triptans. Get it? Tripod for triptans? Triptans are a family of drugs commonly prescribed for abortive treatment of migraine headaches. Just like NSAIDs, triptans can be used to help relieve the pain of a migraine that's already started. They are used for particularly severe cases of pain where an NSAID is not enough to stop the pain. These are both abortive drugs, which means that they're intended to treat the pain once it's already started. There are some drugs that can be taken beforehand to prevent an oncoming migraine. We'll get to those next. Typical. Rather than that hearty pea soup, this kid would much rather snack on candy. That lollipop he's eating is our recurring symbol for beta blockers, because beta blockers commonly end in LOL. Beta blockers may be used to prevent the onset of migraines due to a complex mechanism that may involve preventing the vasodilation that causes migraines. Next, I guess this kid doesn't need the sled since he's got that tricycle with him. This tricycle is our recurring symbol for TCAs, or tricyclic antidepressants. Get it? Tricycle for tricyclic antidepressants? Tricyclic antidepressants, named for their 3-ringed structure, have been shown to be effective for prophylaxis or prevention of migraine headaches. Though you don't have to be depressed to benefit from these drugs, there's actually a strong relationship between depression and migraines. If you have one, you're more likely to get the other. By blocking the reabsorption of certain neurotransmitters like serotonin, antidepressants like TCAs stop these neurotransmitter levels from getting too low, which has been shown in some cases to cause migraine. Whoops! It seems like this migrating bird knocked this dad's toupee right off his head when he flew into him. This toupee is our recurring symbol for topiramate, or toupee-ramate, if you will. Topiramate is another prophylactic drug used to prevent the onset of migraines. More specifically, it's an anticonvulsant, so it's commonly prescribed for seizures and other kinds of nerve pain. Though migraines don't cause seizures or vice versa, migraines are thought to result from aberrant nervous activity in the trigeminal nerve and other parts of the brain. This explains why an anti-seizure medication that depresses brain activity can help treat migraine. Finally, this toupee-wearing dad wasn't just going to settle for any old place to stay in during his fancy birdwatching adventures. This swanky hotel even has valet parking. See that sign the kid is pedaling past on his way back into the hotel room? This valet sign will help you remember valproate. You know, valet for valproate. Valproate is another anticonvulsant that's also prescribed for preventing migraine headaches. All right, that was a lot on migraine headaches. Let's recap what we've covered. Migraine headaches are a type of headache caused by irritation of the trigeminal nerve that innervates the meninges of the brain. This leads to the release of vasodilatory neuropeptides, including substance P and CGRP. The resulting vasodilation and leakage of fluid from blood vessels can cause inflammation, resulting in pain. The clinical presentation of migraine is a throbbing pain that classically affects only one side of the head. This headache is often associated with nausea and vomiting, aversion to light and sound, as well as distinct visual disturbances called auras. These migraines typically last around 1 day and can be treated with NSAIDs and triptans to stop the pain. Other drugs can be used to prevent the onset of the migraine in the first place, including beta blockers, tricyclic antidepressants, as well as anticonvulsants like topiramate and valproate. Okay, now we're really done. It's time for me to do some of my own bird watching and calligraphy. I'll see you in the next video.